The first 10 minutes decide whether a sick child lives or dies, and most doctors get this wrong. A sick child arrives in the emergency room. Everyone asks for labs, diagnosis reports, but the child don't have time for that. Before touching the child, I looked at only three things. Enjoy this video and tell us what topic should we cover next. Your feedback matters. First impression pediatric assessment triangle. Before touching the child, we perform rapid visual assessment called pediatric assessment triangle. This triangle includes appearance, work of breathing, circulation to skin. Appearance. Assess mental status, muscle tone, and response to surroundings. A lethargic, poor tone, and unresponsive child is always a red flag. Work of breathing. Look for respiratory rate, whether it's apnea or tachypnea, chest retractions, grunting, or abnormal sounds like wheeze or stridor. Circulation to skin. Check skin color, capillary repelling time, and temperature of extremities. Pale cyanosis, delayed repelling time, or cold extremities are red flags that indicates poor perfusion. If any part or part is abnormal, the child is sick and need immediate action. Step 2. And now we move to the primary survey, which must be completed within the next few minutes. In primary survey, we have a ABCD approach. A is for airway, B for breathing, C for circulation, D for disability, and E for exposure. A for airway. Check if the airway is open and protected. Look for obstructions, secretions, and stridors. B is for breathing. Assess respiratory rate, oxygen saturation, chest movement, and auscultation. Give hypooxygen immediately. If breathing is inadequate, start bag mask ventilation. C is for circulation. Check heart rate, pulse quality, capillary repelling, and blood pressure if possible. If signs of shock are present, establish IV or IO access and give 20 ml per kg isotonic fluid bolus. D is for disability. It means mental disability. Quick neurological assessment using AUPO. A. Alert. V. Voice response. P. Pain response. U. Unresponsive. Check glucose level. If hypoglycemia is present, give 10% dextrose 2 up to 5 ml per kg. Is for exposure. Fully expose the child to look for rash, trauma, bleeding, or dehydration while preventing hypothermia. In primary survey, we have ABCD approach: A for airway, B for breathing, C for circulation, and D for disability, E for exposure. After primary approach, we go to another step, that's rapid history. We have a mnemonic of sample: S for symptoms, A for allergies, M for medications, P for past history, L for last meal, and E for events. We rapidly take history of these things that can give information about the disease. In the next step, we can categorize and treat the patient. We can recognize respiratory failure, shock, CNS emergencies, sepsis, and trauma, and go to the treatment. By the end of 10 minutes, you should have identified the main life-threatening problem and start treatment. Remember, treat first, diagnose later. Remember, in emergency condition, treat first and diagnose later. In the summary of this lecture, we should know that we have 4-step pediatric assessment triangle: primary survey, rapid history, and at the end, categorize and treat. Enjoy this video and tell us what topic should we cover next. Your feedback matters.